You know, when we think about surgery, we often picture the drama ending once that final stitch is in place. But for a gastrointestinal surgeon, well, that's often when the real nail-biting begins. Today, we're diving into why GI surgery is packed with these unique complications that go way beyond the operating table, turning what looks like a perfect procedure into a profound and often very humbling experience.
In fact, you'll hear surgeons use that exact phrase all the time, the humbling experience. It's this powerful idea that even a technically flawless operation can still go south. And it's not because of a mistake or lack of skill. It's because the human gut is just so complex and unpredictable. Getting a handle on this idea is really the key to understanding all the risks we're about to unpack.
So to really get it, we're going to walk through the 5 stages where things can go wrong. Think of this as our roadmap, right? We'll start inside the OR, then move through those super critical days right after surgery, and we'll even look at issues that can pop up months or even years down the road.
All right, so our journey starts in Act 1, right there in the high-stakes environment of the operating room, where the most immediate dangers are lurking.
Okay, so the single biggest problem a surgeon can face in the middle of an operation is uncontrolled bleeding. And the reason for this is actually pretty simple. The organs of the GI tract, we're talking the liver, the pancreas, the intestines, they are all incredibly rich with blood vessels. I mean, it's their job to absorb nutrients, and to do that, you need a massive blood supply.
And these risks can be incredibly specific to the operation. During certain colon surgeries, for instance, surgeons have to navigate this thing called the presacral plexus. It's like a delicate web of really thin-walled veins. If you injure this network, you can get massive bleeding that is notoriously hard to stop. It's like a known enemy on a very specific battlefield.
The next major risk is accidentally injuring a nearby organ. Now, in a textbook, anatomy is crystal clear. Everything has its place. But in a real patient, especially one who has a lot of inflammation or a bad infection, tissues can get all swollen and basically fuse together. That distortion can make it incredibly hard to tell one structure from another, and that can lead to a classic complication, like injuring the common bile duct while taking out a gallbladder.
Okay, so now we're moving out of the operating room and into what many surgeons will tell you is the most critical phase of all. This is Act 2, because as they often say, once the operation is over, the real surgery begins.
So that first week really breaks down into 2 crucial phases. In the first 24 hours, the worries are immediate, right? Things like a slip stitch causing a bleed, or the patient going into shock. But then, as we move into days 1 through 7, a whole new set of uniquely GI complications starts to emerge. This is where the gut's unpredictable nature really shows itself.
And right at the top of that list is something called an anastomotic leak. This is, without a doubt, the single most feared complication in all of GI surgery. So, an anastomosis is simply the spot where a surgeon has joined 2 ends of the bowel back together. A leak means that connection has failed, and now intestinal contents are spilling out into the abdomen. It's a disaster.
Surgeons are just constantly on high alert for the warning signs. The classic story goes like this. You have a patient who seems to be recovering just fine after, say, a colon surgery. Then, all of a sudden on day 4 or 5, they spike a high fever, their heart rate shoots up, and they develop this terrible abdominal pain. Those are the big, flashing red lights that a leak might have happened.
Which leads to a really crucial question, doesn't it? If a surgeon creates a perfect, watertight connection in the OR, why on earth would it suddenly fail 4 or 5 days later? It's a huge puzzle, and the answer really gets to the heart of why GI surgery is so humbling. Well, the answer often has nothing to do with the stitches themselves. A leak can happen if the blood supply to the tissue just isn't good enough for it to heal properly. It can happen as there's too much tension pulling that connection apart. Or it can be totally undermined by a hidden infection, or even if the patient is just malnourished and doesn't have the basic building blocks to create strong scar tissue.
And the stakes here could not be any higher. When a major anastomotic leak happens, and it leads to widespread infection and sepsis, the mortality rate can be as high as 20 to 30%. This is the stuff that keeps surgeons up at night.
Now for Act 3. So even if a patient successfully gets through that critical first week, the story still isn't over. The body's own healing process can end up creating brand new problems weeks, months, or even years later. This timeline really shows how these different issues can emerge over time. Just a few weeks after surgery, that reconnected part of the bowel can heal with so much scar tissue that it narrows and causes a blockage. Months later, the main incision on the belly might weaken and form a hernia. And then years down the road, we see the rise of something called adhesions. Adhesions are basically bands of internal scar tissue that form as the body recovers. You can think of it like an over-enthusiastic repair job. In its attempt to heal all the surgical trauma, the body lays down this sticky internal scar tissue that can accidentally glue loops of bowel together. And this becomes the single most common reason for a blocked intestine years after the original surgery.
So this brings us all the way back to our central theme. We've seen the what, the bleeding, the leaks, the blockages. Now, in our final act, let's explore the why. What is it that makes GI surgery so uniquely humbling?
First off, every single patient is different. Textbooks show you this idealized, perfect version of anatomy, but in the real world, everyone's blood supply, their tissue quality, it all varies. A surgeon has to constantly adapt to whatever they find on the table, and that variability adds this huge layer of unpredictability to every single case.
Second, and this is a big one, the GI tract is home to trillions of bacteria. Operating on the colon is kind of like operating in a contaminated field. So despite every precaution you take, even a tiny amount of spillage can seed an infection that completely undermines healing and leads to an abscess or a leak.
Third, you have to remember, surgeons aren't operating on perfectly healthy people. Their patients often have other conditions going on, things like diabetes or obesity, or they might be malnourished from cancer. And all of these things dramatically impair the body's fundamental ability to heal a wound or fight off an infection.
And finally, there's the body's own reaction to the trauma of surgery itself. A major operation triggers this massive stress response. It's a whole biological cascade of inflammation and immune suppression. Now, while that's intended to help, this very response can, paradoxically, interfere with the delicate process of healing.
Which brings us to this really powerful lesson that's often shared among surgeons. It just perfectly sums up everything we've been talking about. The technical part of the job might end in the operating theater, but the biological challenge, the healing, the risk of infection, the potential for a leak, that is the real surgery, and it all plays out over that critical first week. So, in the end, it all comes back to a simple but really powerful way to think about it. The major complications of GI surgery almost all fall into 4 big categories. Bleed, from hemorrhage. Leak, that dreaded anastomotic failure. Block, from either swelling or those long-term adhesions. And infect, the constant threat from the gut's own bacteria. It's a humbling reminder that surgery at its core is a partnership between a surgeon's skill and the body's mysterious and sometimes very unpredictable power to heal itself.